Okay, we're here with Wells Matthews, who's had several sessions now over the last month with Daryl and the applied postural mechanic technique. Um, can you talk about your experience, Wells? Sort of before and after.
Well, so far it's a life-changing experience in the sense that um, before the posture, gait, movement was constricted compared to what, say, would be considered normal. We're getting much closer to normal range of motion and gait and posture. So when you feel yourself standing different, you feel yourself walking different, that's life-changing.
I know that in the past you've had periodic lower back problems and also a great deal of difficulty in stretching, for example, bringing your hands down toward the floor, toward your feet. Can you talk about that? Has that dramatically changed the range of motion?
The range of motion has dramatically changed, mostly in the hip area, which, since that's the kind of the base of the support of the body, of the torso, that changes your movement in many ways.
In terms of pain and discomfort, you notice a change there too?
That's harder to say in the sense that the pain was occasional, right, as opposed to there all the time. But there's been much less frequency of pain. So there is a change there, but it's not as dramatic as, say, the range of motion, change of posture, change of movement.
And how diligent have you been with the complementary exercises? I know they don't really require that much time and effort, but more persistent frequency and short.
I do it several times a week, but not as much as I should. I should be doing it every day, but I don't quite seem to manage to do it every day. But probably every other day, probably.
All right, well, thanks, Wells. Anything else you'd like to say?
The progress has been quite remarkable to feel.
All right, thank you so much.
Okay.